when you are 65, 70, without an x-ray, you don't do anything. Because when they have a fall, when you're talking about a fall in a bathroom, they are so prone to a hip fracture. Every individual will have different exercises for back pain. If I'm teaching 10 exercises over a period of 3 to 5 days to a patient, maybe 2 or 3 will overlap.
Now, all of India at one point of time was particularly gripped with this one injury called the tennis elbow.
If you're going to play a sport with tennis elbow, you will have to wear your belt. You will have to keep taping it. Indian toilets were the best thing that happened to India, which we removed for the Western toilet. When you squat, squatting is one of the best exercises to strengthen your quadriceps.
Dr. Vibhuti, welcome to the Ivory Podcast. It's a pleasure to have you with us.
It is a pleasure to be here.
I'm curious to know what happens when Vibhuti wakes up with like a backache. Like, what's her go-to, mode?
So I have believed in one thing. So when you have a backache, I obviously switch on, go back to the reason why this happened. So if you're talking to me about personally why it happened. Now if the why is a minor thing, like maybe galat so gaye hain, ya to kuch thoda wazan utha liya hai, and I don't have a backache history, I will let my body heal on its own. Wait. Let's just not get paranoid and rush somewhere and, get it treated now itself. You have in today's city, we are in a rush to do everything on the spot. Instant gratification. That is not something I do. Ice the area is what I normally land up doing. I ice it. You can apply some a Relis spray, Iodex or whatever, one of those sprays, a painkiller spray or a gel. Rest it out for that day. Painkiller only if it is unbearable and you cannot do any of the activities. Otherwise, wait for a day. If it doesn't settle after a day, then you do something. Or then I will maybe treat myself. Or then maybe I will start my stretches. Or go to my clinic and get myself treated. So I will wait.
It's interesting you mentioned the icing bit. And I want to know a little bit about the science of it. Because it's something that, has always helped me. Whenever I play intensely, I come back. What is really happening to the body when an aggravated or an inflamed area is, touched by ice? Like, why is it such a great recovery mechanism?
When we talk about inflammation itself, means there is a swelling. Any part of the body where there is swelling, rice works the best. The acronym of rice is rest, icing, compression, elevation. Okay, so any part of the body. So whenever you have any muscle which is gone into spasm, injured, anything which has happened to it, there is an internal swelling. Whenever there is an internal swelling, 50% of the work is done by ice. Rest, we are there to do the 50%. 50% kaam karke aao. And that only ice does it. You don't need anything else to do it. A lot of people ask me why ice and not hot packs. We'll come to that next. So a lot of people ask me why not hot packs. So hot pack is a feel-good factor. It is not that it's not going to work, but when you have acute pain, when you have a spasm on the spot, like morning spasm hua, evening kya karna is ice. So immediately you do ice because immediate inflammation stops with ice only. Chronic pain ke liye, you can have a hot pack. Hot pack doesn't do harm, but it doesn't give you instant relief. It just increases the blood flow in that area. It increases the capillary blood flow in that area. But instant relief only ice will do. Anybody who's has had any injuries, you must have had an injury, will only say that ice works much faster compared to a hot pack, and ice works much better and gives you much faster relief comparatively.
Got it.
Yeah.
And, you mentioned this bit about spasms and, as you we were talking about Ivory a little earlier. Ivory is a product that's actually meant for healthy and active aging. And some of our customers actually, or early users rather, are beyond the age of, 55, 60. And, falls is often something that, it could happen anytime, right? Like a grandparent falling in a bathroom, for example, is very much, could be a common incident in many households. When something like that happens, and a person is, let's say, 65, 70. Does ice work in that situation as well? Or if, let's say...
when you are 65, 70, without an x-ray, you don't do anything. You do not. Because when they have a fall, when you're talking about a fall in a bathroom or they've slipped somewhere, they are so prone to a hip fracture. That age group at the age of 70, 75, bones are getting osteoporotic. Even if you're not osteoporotic, you are 100% osteopenic. Osteopenia means lack of calcium, which is happening in spite of taking, even if that person has taken calcium all his life, you cannot stop the aging process. It is going to happen. The wear and tear is going to happen. So the first thing, if a patient has fallen, like I get calls of a frantic daughter-in-law, of a frantic daughter saying that, oh my God, my father has fallen down. Now what do? I will first say, go to the doctor, get an X-ray. Right now, take him to the emergency. Because you need to rule out fractures. So nothing, you do not put him on the bed and you do not ice him and you do not wait for 24 hours. That age group ke saath, you cannot take any chances. Not possible at all.
Let's talk a little bit about osteoporosis, because that's again a condition that can happen to a lot of people. For a layman, who's watching this, what does it mean, and how does he or she know that they are affected by it?
Osteoporosis is basically where the calcium level in your bone reduces. Okay, this is something, how much ever calcium you will take, you cannot escape osteoporosis. As you age, it is going to get osteoporotic. Technically, if you show me an X-ray, the X-ray will be less, it will be much more opaque. It will not have too much of whiteness. When you see an X-ray on a black screen, there will be a lot of white bones and all that. Whiteness will reduce and it will be more blacker. Now, when that whiteness reduces, means your calcium level is going down. So, a lot of people who are 75, 80 do have that thing. That is the reason when you are in your 40s and 50s, you need to take care of your body. You need to strengthen the muscles. You cannot stop the bones from aging, but you can help the muscles to strengthen so that they protect the bone. That is the most important thing that we constantly harp on. That you cannot. Bones are going to age. Muscles, you can keep strengthening them. If your muscles are strong, it will hold the bone. You can pull more time. So that is one thing that can be done. Calcium supplements, everybody should start once they cross 45. 40 for women, 50 for men. They must start calcium supplements. Because हमारे diet में है ही नहीं इतना calcium कि we can, how much are you going to have? How much calcium can you have? It is not possible. So you must have the calcium supplements regularly, and you must be prepared. Okay? We need to strengthen our body in general. If we are taking strengthening into consideration, if we are doing weight training is one of the most important things that you must do. Even if you are lifting 2 kilos and 5 kilos, it doesn't matter. If you are like 50 and 60, even if losing 5 kilos, it's fine. Lift weights, that will slow down the process of osteoporosis. I'm not saying it will stop it. It cannot stop. It will slow it down. That should be the aim. That how you slow down everything, what takes 2 years to happen, let's make it happen in 5 years. So you pull more time. That's the max that you can do, not more than that.
It's actually one of the first times that I've heard somebody explain it to me in such simple terms.
Are you serious?
So thank you for that.
Okay.
But I want to touch also upon, because a lot of our customers are also women, and I noticed you mentioned that women should start taking these supplements earlier. What is it about the anatomy of men and women that makes women a little more prone, I would say, earlier than let's say men?
So, in case of women, a lot of women become perimenopausal by the time they are 42, 45. You have so many cases where you hear the uterus has to be removed. You have young girls who are suffering from PCOD. The whole environment is there. Today, like during my time, girls used to get their periods when they were 12 and 13. Today, girls get their periods at 8 and 9. So, when you are that young, you're going to get menopausal also younger. Na? The cycle is this much only. You cannot extend that cycle. So then women are 42, 43 mein perimenopausal. Once you're perimenopausal, means your calcium level starts dropping. Once you touch menopause, so by the time, if you're perimenopausal at 42, for instance, another 3 to 5 years, you will be menopausal. So by 48, 47, 48, your calcium level have gone down drastically because your estrogen level has fallen down. Lot of girls, I have a lot of young girls who come to me who hate their time because the correlation is before their periods, they get severe back pain. They are not able to understand that back pain is because they're going to get their periods in few days or couple of days ke baad unko periods. So they get damn irritated. They're like, why is our back hurting? Doc, do something. We are not able to get up. And they crib, oh my God, we hate our periods. I tell them periods is the best thing that's happened to women. It is the most important thing that's happened. It is keeping our estrogen, it's keeping our calcium level at a particular time where we can function mentally and physically well. That is the most important thing. It's keeping a mental balance. Estrogen जैसे गिर जाता है, calcium level उतना ही गिर जाता है. The moment those two fall, that's the reason you need to be prepared 5 years in advance to start taking that calcium. Men don't have that. Men don't have menopause, right? So men can start at 50. If women didn't have menopause, then women can start at 50, but we have it. So we need to get the supplements earlier in us. So by 40, 42, 45, latest 45, they should start calcium. That's like the last. They should start calcium.
And, within your practice, with so much of experience under your belt, are there situations when you see, patients come and see you and somewhere at the back of your mind, you wish you actually had a toolkit which, was there in every household that if so-and-so happens, then, do this by yourself and you'll be fine. Could you talk to us a little bit about those cases wherein there are things or exercises or common situations wherein, we feel a certain pain and by just doing maybe one or two things, like you said, we could give it another 24 hours and see if the pain subsides or not.
So if you're talking to me about doing exercises, exercises is like a DNA. It is different for everybody. Like I will give you a case of an ankle injury. In ankle injury, you can have a fracture, you can have an avulsion fracture, you can have a strain, you can have a sprain, you can have a ligament tear. Everything will show differently. In everything, the exercises are different. So I cannot give, like a lot of people tell me कि आपके पास कोई वो नहीं है, पेपर नहीं है जिसपे सब एक्सरसाइज लिखा हुआ. ऐसे नहीं होता है वो. ऐसे नहीं होता है. Every individual, a back pain also every individual will have different exercises for back pain. Some of them will overlap. So it is not like I will, if I'm teaching 10 exercises over a period of 3 to 5 days to a patient, maybe 2 or 3 will overlap. But otherwise, all of them will be individual. It will be according to his body type, his weight, his ability to do his exercises, the flexibility. So I cannot have one stereotype group of exercises. अरे ये हुआ है तो इतना करो. वो possible is, and if you do that, it is a very wrong way of approaching because you're not removing the problem from the root. It is not coming out from the root. You are just bandaging it. You're just like, okay, temporarily थोड़ा better करने के लिए psychologically, but the problem has not gone away. So till you don't show it to either a physio or an ortho or anybody who you're going to, it doesn't matter who you have gone to and who knows how to treat you, till then I would not suggest do random. People, the way online offline has happened, the way the whole COVID happened, people were randomly doing exercises, looking at online exercises. People are seeing online videos and doing exercises. Now if you talk to them, they will all tell you it helped them just 20%. 80% pain aa jata hai back mein, kyunki it is not removing it from the root. So temporarily you're feeling damn good. Arey, online exercise free of cost. It's amazing. It's helped me so much. But you wait for another 15 days, you wait for another 20 days, you wait for a month, it will come back again. So whenever any patient comes to me, I always do a thorough history. So if my first time patient always takes around half an hour to 40 minutes with me. I make sure all the investigations which are needed are done. If you have them, show it to me. If you don't have them, I will make you do them without taking the full history A to Z. From how you're sitting, what is your chair like, what is your, I call for snaps, I call for photographs. Send me office chair photo, send me your car ka seat ka photo. I mean, car ka seat zarurat nahi padta as long as they tell me which car they are in. So most of the cars I know how the seats are. So everything is shown to me. After that, we will have a diagnosis. We will have a differential diagnosis, we'll have a diagnosis, then we'll have short-term plan and then we'll have long-term plan. So first, let's do it short-termly and then what is a long-term plan? In long-term plan, home exercises are given. A home program is given. But short-term, first, I need to know the whole history. So the way you said a toolkit, it's not common, it's not same for everybody because every individual is different. So we have to treat them differently.
Got it. So highly personalized sort
totally
of approach
personalized.
to everyone.
Totally personalized. Otherwise, it would become like a nice yoga or a Pilates class. Na? Then, matlab, wohi, like everybody 7 or a dance or an aerobic class where everybody is doing the same thing. But when you are in pain, the reasons for pains are different. Pain is a very different, whole different scenario. Chronic pain, acute pain. At least for me, I become too thorough with my with my investigation to just randomly say, "अरे ये 2-3 exercise करो ठीक हो जाएगा." ऐसे नहीं होता. So that is one thing that I have believed in the last whatever years I've been practicing, 20 plus years that I've been practicing. I firmly believe in that and I stand by that.
Dr. Vibhuti, we hear a lot about chronic pain within our audience, and I would love to know at what point of time should a person just live with chronic pain versus taking some steps to improve it?
So, chronic pain has a number of reasons why the patient has got chronic pain. Is he following the advices? If he's gone to multiple physios, has he done what the physio has told him? Has he gone through the whole process? Has he, what has his lifestyle changed? There are certain things which a physio will say, okay, you cannot do this. Has he followed those things that he cannot do? Or has he finished the physio and gone back to doing those same things? So even when you are suffering from a chronic pain, there has to be a reason behind it. First, get to that reason. Correct that reason and you can correct the pain. So there is no way that if you are having a chronic pain with good investigations, where your investigations are all okay. Now, if you have investigations only which are not very great, yes, chances are then you are somewhere in between a surgery and in between just like, I'll give you an example of a patient of mine. He must be 69, 70. Super fit. He plays golf, he goes for e-biking, super fit, okay. His MRI, if you see his MRI, when I saw his first MRI, I'm literally looking at his MRI and I'm looking at him. Because if I had seen his MRI without him, I would have said you need a surgery today. Or you needed a surgery yesterday. His MRI was so bad. But today, when I see him physically, when I see his symptoms, he's fab. So no surgeon will also pick him up for surgery, even though his MRI is bad. So after having a bad MRI, he is so... I'm not saying he's fit. He has his pains and aches which is there. So he comes to me like twice a month to get it fixed a little bit. Then 20 दिन खिंच लेता है. फिर 20 दिन के बाद वापस थोड़ा pain हो जाता है. So he cannot be totally treated. Because he is 5 steps away from a surgery. And we are just pulling time so that he doesn't get to do a surgery. So then physiotherapy becomes twice a month regularly. That is a those must be like maybe 10% of the cases. Most of the cases of chronic pain do get resolved. There is not a problem if there is a protocol which they follow properly. Lifestyle changes, get the correct habits, sit the correct posture. Lot of those things, if you do correctly, it gets solved.
That's super encouraging for anybody who is listening to
Absolutely.
this. That, you know, that even if you're suffering for 5-10 years,
doesn't matter.
Go to a specialist.
Yeah, no, find out the root of why you're suffering. There has to be something which you have not done correctly, or the doctor has missed it, or your therapist has missed it. And if every dots are connected, you can 100% be okay. Unless and until investigations are bad. Again, I'm sticking to that. If investigations are good, there is no way that you cannot be corrected.
That's a good segue into this earlier question I was asking you, when we were chatting, which is that I think one of the things that, let's say, people my age group, right, 35 to 45, we think we are on the brink of, being fit, but maybe we are not. When there is pain in some part of the body, how do I know when I should approach an orthopedic doctor and when I should go to a physical therapist?
So, in my 20 years when I have been with patients, my referral from ortho to physio is very less. Most of my patients come directly to me, or patient to patient they come. Okay. One of the biggest reasons is that most of my patients are like, first let us show it to her. And if she says go to an ortho, we will go to an ortho. Okay. So things have kind of reversed, changed and all. I stand by the fact that if the physio tells you that this is not going to be treated by me, I mean, if you've gone to a proper physio, most of the physios are very good. Bombay has great physios. If you've gone to a good physio, so most of the time they will tell you, what, this is not something that I can do. Please go back to your ortho, whoever you want to go to. Get his opinion. Let's get a couple of investigations. Let's start on some medications. You are suffering from some vitamin deficiency. You're suffering from ABC things. Let's take his opinion. So they all go back. Unless and until there's a trauma, unless and until the patient is suffering from dislocations, fractures, those cases which are there is a totally orthopedic work. We don't come into the picture for 6 weeks. So, every physio should have this, at least I have this, that in 2 sessions, if I don't see 20-30% of improvement, I'm on the wrong path. I need to reval. I need to constantly keep going back, keep checking my investigations. Have I missed something out? Blood test में कुछ miss कर दिया है मैंने. Vitamin D deficiency है, B12 deficiency है, uric acid बढ़ गया है. क्या हुआ है? Why is it not improving? So every time, every session, there has to be an improvement. So if there is not an improvement, for me, most of my patients don't come to me for more than 5 sessions. I don't take patients for more than 5 sessions unless and until they are post-recovery of a surgery. Suppose you've had a fracture, then you are in for a long haul. But otherwise, basic chronic aches and pains, 5 sessions. After 5 sessions, you should be approximately 70% better. You should be better that you can at least do your day-to-day activity. You can go back to work. Today we are living in Bombay. We are living in a city. You cannot tell a person take a bed rest. I don't agree with the fact that bed rest है. अगर bed rest है, तो फिर you are at a very very bad stage. That means तुम्हें surgery next चाहिए. But if you've come to a physio and then you're doing total bed rest, it is not a very good thing. Spine has only one work. It has only one job, to flex and to extend. If you're going to put it straight on the bed, you are actually harming the spine more. If you're talking about a back pain, rest of the things also you cannot. Today people have to work every single day. So I cannot tell a patient that 15 days bed rest. वो नहीं चलता है. So there has to be, and today physiotherapy has improved leaps and bounds. Today we are not where we were 20 years back or 10 years back for that matter. Today we have so many mechanisms, so many exercises, so many ways to get it healing faster. So we have ways to do it. ऐसा नहीं है कि नहीं है. You have to keep yourself updated all the time, which every physio does it, and I'm sure everybody is doing it. So you must keep yourself updated all the time. So that is not a thing. And after 5 sessions also, if I'm not seeing an improvement, we go back. We get more health professionals into the picture. We get the orthopedic surgeon, we get the general physician, we get whoever is needed, we get them and we assess. I've had conference calls with so many of doctors together. I've called them up, I've asked radiologists, I've said, how do I do this? What do I do? If you are going to look at a patient with zero ego, I think everything is great. There should be no ego. Phone उठा के बात करो, पूछो questions पूछो. So they should also not have it with you, and you should also not have it with them. Touch wood, for me, my relation with my doctors have been fab, and they all know that. But there are relationships which are a little different, which are a little, and उसमें patient suffer करता है. Shouldn't happen that way. That is the most important thing.
We would love to know about some of the common ailments that you have seen among, let's say, the retiring audience or the retirees, like people when they are sitting at home, they're not as active as they were earlier. Is there a common trend that you're seeing, and are there any common ailments that you have seen lately?
So the age group that you're talking to me is 60 to 80.
Yeah.
That is the age group we will talk about.
55 to upwards.
Yeah. So today's actually 55, 60s are quite spry. They are like pretty much active and they're pretty much go-getters as such, fortunately. What we see post 60 to 80 is a lot of knee surgeries. Lot of knee replacements. I think every family will have someone with a knee replacement.
That's true.
So everybody. Now, I don't know if anybody has had any retrospection on the fact that why do we have so many knee replacements now? Why didn't we have it during our dadi's times? Hamari dadiyan, bichare, all of them passed away. Nobody had a knee replacement. There was no knee replacement. Why is it happening now? One of the biggest reasons why knee replacements are so common in our mothers, in our mother-in-laws, and the generation today is because of lack of Indian toilets. Indian toilets were the best thing that happened to India, which we removed for the Western toilet. When you squatting is one of the best exercises to strengthen your quadriceps. When your quadriceps are strong, when your hamstrings are strong, your knee remains strong. Aging process in the knee happens, but you don't come to know. The way I said, if your muscles are strong, you do not come to know if the bone is weak, unless and until you don't fracture it. But if your muscles become weak, the bone gives away. So when we had Indian toilets, we had a sitting kitchen. Those were the reasons why we never had issues with knee replacements. Today, every second person is having a knee replacement. So this is one very, very common thing. Second thing also is I see a lot of frozen shoulder because diabetes has become very rampant. Diabetes is directly related or directly associated with frozen shoulder. Any person who's diabetic, who has been having diabetes for a long period, at some point in his life will suffer from frozen shoulder. Okay. Now, frozen shoulder, I'm talking about the aged frozen shoulder. Frozen shoulder is not it is a symptom. It is not a condition. So we normally confuse frozen shoulder as a condition. Okay, frozen shoulder is a condition. No, the condition is tendinitis. The condition is pre-diabetes. The condition could be scapulitis, but the symptom is frozen shoulder. So we need to first diagnose what is the condition. So frozen shoulder, मतलब पूरा तुम्हारा shoulder mobility खत्म. Another reason why that has happened also in the age group of 60-70, हमारे kitchen में हम लोग सब पहले ऊपर रखते थे. अभी हमारा सब कुछ ये level पे हो गया. So everything has become at this level. Our whole kitchen has become at this level. When things used to be on top and when there used to be no servants, people had to go up, whether it was men or women, to go up. So 5 times in a day, your hands were getting raised. Today, that is not happening.
So basically, this
Lifestyle,
increased
absolutely.
access to convenience has
Absolutely.
hampered our
100%.
natural anatomical
100%.
movements in some way.
100%. And then
Got it.
obviously we have 20,000 classes that we go to kind of get that mobility back. And when women come to me, I mean, for that matter, I tell my mother-in-law also, work. You work, you live longer. The moment you start sitting, you're cutting down your lifespan. If you are healthy, if your organs are fine, if you don't have any disease, if you are, you are able to walk, you're able to communicate, you're mentally okay, please work. So my mother suffers from fibrosis of the lungs. I yet tell her, some activity is a must. You cannot sit the whole day and say, oh my God, I've got this disease and what am I supposed to do? Doesn't matter. You've got it, you deal with it. You're taking treatment for it, but some activity karo. It's a must.
You spoke about the knee, reconstruction, knee, surgeries, replacements. What's the sign that, because sometimes you also have regular knee, like if I run for, let's say, 50 kilometers, suddenly I'm likely to have some, tension in my knee. How does a 55, 65-year-old know that this pain is different from, let's say, a normal regular pain? X-ray again?
X-ray only. The moment you see X-ray, the moment you see spiking, you will see osteophytes, you will see the gap reduced. They are very typical cases. Again, fortunately, what happens is even if your X-rays are not very great, and when you go to an ortho, 80% of the orthos will tell you, please try physio. Physio karo, 6 mahine karo, 7 mahine karo. Nahi hua theek to we'll do the surgery. So most of the time that also happens. So that is also not an issue. But if the knee is too bad, and surgery is the only option, you must do it. If you are 70 plus, just do it. It's okay. Because you are 70, if you are taking an average 8 till 85, why do you want to spoil your 15 years? Because physio then will not work. It will work only till a point. Your exercises will work till only a point because your muscles are anyways weak and your bones are now completely gone. So you do a knee replacement and then you strengthen now. So it doesn't make any sense to kind of keep waiting and keep pulling time and saying that, "Arey, hum physio karenge to theek ho jayega." Nahi hoega. So some people are a little scared also, to go through a surgery. But it's become so good now. The reconstruction surgery, the TKR has become so advanced. Now you have robotic TKR and you have such an amazing technology. And it's such an easy thing. In 2 days, 3 days, you go home. Physio is also so protocolish. Like everything is like set. And in a month's time, the patient is absolutely okay.
So 2 questions coming off that. Explain TKR in like a layman's terms. And number 2, let's say once a person goes back to a knee replacement, I think sometimes there is this common myth that, will I get my 100% of my mobility back?
Oh, yeah.
So could you clarify that as well?
Yeah,
that
yeah.
A knee replacement does not necessarily mean it's a subsidized or a slightly lesser version of whatever
No,
your
absolutely
knee is.
not. So TKR is basically total knee replacement.
Mm-hmm.
And you have 2 joints in your knee. One is the femoral and tibia joint and one is the patella. So there are 2 joints. Everything is replaced. So from here to here, everything is replaced. and you have different kinds of material which are there that the orthopedic surgeon decides, and they give you the best whatever is there. And it is done. It's like a very small surgery. It's not like a very full day surgery also. It's very easily done, and the post recovery is fab. The prognosis is superb. Statistically, it's 99%. I'm not giving 100% anywhere. 99% everybody recovers, and there is no issues in mobility. You are able to do everything that you are able to do with a natural knee. In fact, more. The only thing that you may not be able to do, or people tell you not to do, or even I would advise, or even the orthopedic will advise, is don't sit on the floor cross-legged. That's the only thing that we don't do, because it kind of twists. That's the only reason. Otherwise, everything. And most of the people who go through TKR anyways have stopped the habit of sitting on the floor for a very long time. तो वो लोग वैसे भी नहीं करते हैं. तो वो लोग तो खत्म ही हो जाता है sitting on the floor, which is okay. So that otherwise there is nothing that a person who has done a knee replacement cannot do.
Let's talk a little bit about the frozen shoulder issue a bit, and I think the same curiosity I have around the condition. When is it, let's say, just a normal inflexible shoulder that can be solved by stretches versus a proper frozen shoulder situation?
So a frozen shoulder does not show on an X-ray. Okay, on an X-ray, your X-ray will come normal. So a lot of people will say, "Humko shoulder mein pain ho raha hai." It will come normal. Again, the shoulder, the neck is one unit. You have to again make sure that your history is correct. Sometimes the neck pain also goes down to the shoulder, which gives you a feeling that my shoulder is also hurting. But it could be a cervical issue. Okay. Once you have isolated the cervical and say, no, this is a pure shoulder issue, there are a lot of things that are there. It could be a rotator cuff injury. It could be a tendinitis, tendon swelling. Tendinitis means any swelling. So tendon swelling ho gaya hai, rotator cuff strain ho gaya hai, rotator cuff tear ho gaya hai, deltoid tear ho gaya hai. So this can happen with people who are doing a lot of weightlifting. This happens when you have weightlifted a bit too much and your shoulder has not been able to. This happens a lot in athletes. This happens in players who are playing badminton. Tennis mein kam hota hai, but badminton, the overhead activity that is there, happens a lot. So you have multiple reasons why a frozen shoulder can happen. Frozen shoulder happens when you neglect it. When there is a neglect. Because you are having people sleep on one side and they don't use that hand much, especially the left hand. Sorry, I'm a lefty. So people sleep on the left side, they don't use that hand much. They don't use it, and then suddenly one fine day they're lifting that and they're like, oh my God, I'm stuck. Okay, because they've not used that hand much. So it could happen for the most randomest reason. Diabetes it always gets aggravated. Diabetic patients must do upper body exercise. They cannot forget upper body. They have to do full body exercise. They have to walk every day for 45 minutes. They cannot escape it. So isme you can, suddenly you will come to know that and there is no reason for it. Iska koi reason nahi hota hai. And the exercise program is also very simple. As long as you follow it, it's going to be good. And you get full mobility. In frozen shoulder, aisa nahi hota hai. Matlab, if the reasons are very simple, like you don't have actually a tear inside or you don't have a very, very bad shoulder, it can be resolved very easily. Now, if it is a bad shoulder, not resolving, you need to go for an arthroscopy. Then surgery does come into the picture, but that is a second. A basic frozen shoulder can be very, very well taken care of by physiotherapy.
And just to touch upon arthroscopy, is it the same as X-ray or slightly different?
Arthroscopy is a surgery.
Okay.
Arthroscopy is when you have a tear in the rotator cuffs, in the deltoids. You have tendinitis, which have muscles which are torn inside. Once the tears are there are certain tears which heal on their own. There are certain tears which don't heal. So shoulder is such a controversial area where I know patients who go on for years without performing the surgery when I have advised them surgery tomorrow. But they're like, nahi, agar hum itna hi raise karte hain, to hame dard nahi hota hai. Isse upar we go na, then we get pain. So then they do all their work this much. So it's a coping mechanism. It's like, procrastination. They want to just avoid it. So I said, okay, avoid it. You can pull 1 year, pull 2 year, pull 3 year. Ultimately, you will need a surgery. You cannot escape it. But there's no emergency in that. So that is arthroscopy. Arthroscopy is done when these cases are also there. It's done when your shoulder dislocates or subluxates. In those cases also, because the whole capsule has become very, very loose. So there are a lot of reasons why all these things can happen. But they're too technical for you all. Yeah.
Understood. There is one injury which once gripped the imagination of a nation, tennis elbow.
Oh my God.
Two questions. How does a cricketer get a tennis elbow? Number two, what do regular, let's say, racket player sports, maybe tennis specifically, when they get tennis elbow? What is it all about, and what do you do about it?
The extensor muscle of your elbow gets swollen. It's a very thin thing which passes at the elbow. It gets swollen. Tennis elbow, ek baar aata hai, it doesn't go all your life. It stays because you are moving, you're doing work with your elbow. You're constantly going to use it. So it doesn't go. It comes under control. But if you're going to play a sport with tennis elbow, you will have to wear your belt. You will have to keep taping it. You will have to, if you are at a mild...
tape it here?
Yeah. There's a full taping which is done.
Got
Kineso taping which is done. And you also have to wear a belt. You'll see a lot of tennis players, pickleball players, badminton players who will wear a tennis elbow belt. So you will have to wear it. You will not have a choice. Otherwise, you'll keep aggravating it. Tennis elbow exercises are also very protocolish. You have particular set of exercises which you have to keep doing it. But once it comes, the chances of recurring again and again are very high. So it is not something that goes away. That's one of the reasons why Sachin Tendulkar had to do a surgery for his tennis elbow, because he was playing. So you cannot, how much ever conservative treatment you do, over a period of time, if you are playing professionally, you will have to get it treated surgically. If you are not playing professionally, if you are playing just for fun, then you have ways and means to kind of control it, because then you are playing 2 times a week or 3 times a week. Tum itna intense nahi khelte ho. So then you have ways and means to control it. Then you don't need to go to an extreme. But if your lifestyle, if your livelihood is on that, then you have to take it is another picture. So everybody with tennis elbow, whoever gets tennis elbow, chances of it completely going are very less. So first of all, try not to get it only. Because once you get it, wo jana bahut difficult hai.
So how do you try to not get it?
The correct positioning.
Okay.
The position. When I also teach my patients weightlifting also, for example, I'm teaching them how to do weights. When you hold your wrist in this position, you hold your wrist in this position, and you hold your wrist in this position, will all affect different sets of muscles. When you're lifting weights, 2 kilos, 3 kilos. So people in the gym, so all athletes, all people who play sport normally will go to the gym, right? They will have to do some weight training. So वो weight training करते वक्त, वो sport खेलते वक्त, if the angle of your elbow is not correct, if it's hyperextended, that's why most of the trainers will keep telling you, keep your elbow soft. You'll hear this very often, keep your elbow soft.
That's right.
Yeah. So if you hyperextend it, for whatever reasons, your shoulders are tight, you're hyperextended, your chances of getting tennis elbow are very high. So try not to get it only. So make sure that you are following positions of weightlifting. You're following positions when you're playing a sport correctly. Tennis impact jab hota hai, when you're hitting the front shot, you have to make it very, very sure that your elbow is soft. Hyperextend and hitting is going to hamper you. So those are the ways that you have to take care. So anybody who starts playing a sport has to actually do a lot of, and who's very passionate about playing a sport, should, in case of tennis elbow, make sure that you do a lot of research work, or you do a lot of reading, or you do a lot of talk to other people, and make sure that you don't get those injuries. Because this is one injury where the surgeon will tell you for a surgery last. Like ACL tear ho gaya, surgery kara lo. Shoulder mein kuch hua, arthroscopy hai. Nobody will do a surgery very quickly. They will all go through the conservative treatment. And the conservative treatment does not give you 100% results. It makes you okay 80%. 20% will remain. So try to avoid it only first. So I always tell my patients that, especially young boys who are starting at the age of 17, 16, 15, today kids are starting at the age of 12 and 13. And I'm like, I literally do this, that why are you guys starting gym so early? There is no need. Play a sport instead. When you're 12, 13, 14, there is no need to go to the gym. Play a sport, remain healthy. Why do you want to build a body at this point?
So one of the things we always advocate at Ivory to our users is that they should adopt a sport and preferably a racket sport, because it has a lot of impact on longevity.
Yeah.
For anybody who is getting into racket sports, What are the few warm-up exercises specifically with regard to, let's say, badminton or tennis that you would suggest to our audience?
So warm up and cool downs, 20 minutes has to be done.
20 minutes each?
Each
Okay.
has to be done. Do not avoid warm up and cool down. I always give an example of a twig, a branch. Okay, when the branch is very brittle, it's very easy to break that branch. When it is bendy, you can't break it very quickly, right? Our muscles are the same. When our muscles are stiff, it's very easy to injure them. When they are more mobile, more flexible, it is very difficult to injure that muscle. So warm up and cool down has to be done. Whenever patients who play sport come to me with an injury, the first question, did you cool down? They said, doc, we warmed up, we forgot to cool down. That's where the injury happens. So that is a must. Warm up, cool downs, when you are playing a sport and you have an instructor, they have a set of exercises which they give. Do them. We don't land up doing them, and that is where we land up making the biggest mistake. Because when you are young, you are okay. Those injuries will not come and you will be fine. But as you grow older, the injuries will start creeping up. And habit, discipline and habit happens from a very young age. It is very difficult to start something from scratch at the age of 50, 55, 60. But it's easier to do it when you're 20 or when you're 30 or when you're 40 also, to that matter. So it's easier. So when you're starting a sport, start with the right way. Start with a warm-up, play your sport for 45 minutes, 1 hour, do with a 20-minute cool down, and then you're done.
Got it. Thank you so much, Dr.
welcome.
Vibhuti, for such an enlightening
Yeah.
discussion. There was so much to pick up from this. The idea about this podcast came to us at the Ivory team when we looked at the entire discourse of health and wellness in India. Almost all of it was targeted at the 25 to 45-year-old. So when it came to healthy aging practices or how to take better care of your brain health as you age, there was very little real, credible information out there. That's what encouraged us to put this series of podcasts in front of you. On the Ivory podcast, you will meet two kinds of guests. One, people who are way past their 50s and 60s, but they are living healthily by practicing simple, active routines that they will share with all of you. Secondly, we will also talk to experts in the field of healthy aging or brain health. This set will include nutritionists, active health coaches, doctors, and psychologists who will tell us what really happens when you age and what we can do to take better care of our brain health. I hope you find them useful, and we look forward to seeing all of you on the Ivory podcast. Thank you.